Hi there. I'm just wondering if you have an update on the Johnson & Johnson vaccine, and if you could tell us, if BC has a number yet in terms of how many doses may be arriving and who might be up for getting that shot.
Sure, yeah. So that is also something we learned early this morning, that we are expecting, Canada is expecting to receive one shipment, about 300,000 doses approximately, into the National Operations Centre this week. Sometime this week. We still don't have dates for sure, but it needs to be thawed and relabeled, and that we should expect to receive it next week. So we don't have dates yet, but we are looking at hopefully sometime next week. And yes, we have some plans. We're working through those, and we'll let people know when we finalize them. But this is a single dose vaccine, so that makes and it's fridge stable once it's been thawed and repackaged and shipped to us. So that gives us some flexibility in targeting certain populations, particularly people who it may be challenging to find for dose 2. So I'll let you. So that's what we're looking at right now. And the team is coming up with some recommendations that we'll be making public as soon as we're finalized and make those decisions.
Binder, do you have a follow-up?
I do. I just wanted to ask you also about, we were talking about everyone who wants one will be on track to receive a dose of vaccine in BC by July 1st. So I'm just wondering, we're hearing that tomorrow President Biden will be announcing perhaps new changes to CDC guidelines. And what do you want people here to keep in mind until they're able to receive a second dose in terms of, both their level of immunity and potentially visiting with others this summer, people who may have also only had one dose?
Yeah, so I think we are learning a lot, mostly from the UK, who have a very similar program to ours in that they've extended the interval for dose 2, that there are a lot of things that we can look forward to after a certain period of time with a certain number of people, so that the critical mass of people being at least 21 days after dose 1. So think about that in terms of our time period. We are hopeful if we get the vaccine that we've been promised, particularly the increased amount of Pfizer that we're due to receive next week, that we have increasing confidence is going to come, that we might be even ahead of that timeline. But be that as it may, right now we have a lot of virus that's still transmitting in our community. If we look at the United States, it's a good example where they have a lot of transmission, and when you reach the certain critical mass of people, you start to see transmissions decreasing, with the exception of some hotspots. We've seen the same thing happen in Israel, where they had very high rates of immunization plus transmission, and then when you reach a certain level, it starts to fall off. We're seeing the same in the UK. So those are the things that are the real world experience that we're looking at to understand what might happen here. Right now, and we've seen this as well across the country, to protect people during this period of time where we still have a lot of circulating virus and not everybody who needs it has had a vaccine, we all need to pay attention to what we're doing to stop transmission. And that means our COVID safety plans in our workplace, working from home if possible, keeping our groups small, not having those social interactions where we're seeing transmission take off to larger numbers of people. Those are all the things we need to do now. But when we look forward to the summer, as we get more and more people protected, we're going to take that pressure off our hospital system. We know from data I talked about from the UK that both Pfizer and the AstraZeneca vaccines that are used extensively there, we're in the high 80s in terms of protection, both vaccines in terms of protection against hospitalization. So those are things that we're watching, and there's no reason to believe that it would be different here. So we need to be patient and to stick with the program for the next few weeks until until we get enough people protected that we can, again, take that pressure off the hospital system. And then we can manage with our public health resources, doing the things that we've done, preventing outbreaks, managing outbreaks when they happen, keeping them from being transmitting to larger numbers of people and breaking those chains of transmission. So we're not there yet, but there's a lot of possibilities for what we can see later in the summer.
Next question, Susan Lazarek, Vancouver Sun.
Hi, thanks for taking my question. I had a question about the messaging that goes out to individuals who are in their late 50s now and early 60s, and they're on the age-based vaccine rollout. Is it your right now we're being told we must take the first vaccine that's offered to us, but when those people are waiting for the age-based rollout, if they wait for that, then they're freeing it up for the younger people. Is that part of the messaging that you'd like to get out, or are we still being told no matter what your age, take the first vaccine that's offered to you?
I'm not sure exactly what you're asking, but yes, if you are registered and your age comes up and you're said it's your chance to book, go and get your vaccine. We have, your deferring is not going to make it, not going to allow us getting to that protection for everybody any sooner. So there is enough vaccine coming in the next few weeks for everybody, every adult, between now and essentially the middle of June, the end of June. So when your time comes up, go get your vaccine. And as we go through and cycle through the age groups, more and more vaccine will become available, and we'll go down the age categories quickly. Deferring your own vaccine for another date is not going to get us there any faster, because all of us need to be immunized, and you need to do it yourself to make sure that you're protecting yourself and those around you. Where we've had the vaccine available for younger people, and that's why we've targeted at younger people who may have to wait longer for the age-based program, is the AstraZeneca vaccine. And in BC, we made the decision to make it available through pharmacies primarily, but in some of our high-risk communities, to that age group that we were seeing being hospitalized right now, and that's 40 to 59. And that's why we started with that group. But as we get more supply, perhaps, maybe, and we look at the supplies that we still have in the province, we will look at decreasing the age group of availability for AstraZeneca. So that's the parallel program. But there's no reason to put it off or to think that you can defer it to somebody else. We all need to be immunized. So when your age comes up, when you're offered an appointment to book, go and get your vaccine.
Thank you for that. The other one is just around the vaccine supply that's coming in. You've given us some numbers around how much we're expecting in. The government website says there's 3 priority groups. There's the general population, there's the priority neighborhoods, and then there's the pharmacies. I'm wondering if you can give me a sense of the distribution of incoming supply to those different priority groups. And the priority worker plan seems to be effectively stalled. I don't know if there's any thought to reviving that, or whether it just stays in these 3 main groups that are listed now.
Yeah, so I wouldn't have put them in those groups. I'm not sure what you're referring to be honest, but we do have the main base of our program, where the majority of the vaccine goes to, is the age-based program, and we're moving through that, as you know, as quickly as we can. We have, from the very beginning, identified communities where it doesn't make sense to go back multiple times, so smaller communities, ones that take logistically challenged to get to, etc. So we've done quite a few communities that way, and we've targeted communities where there's high risk of transmission, and we've changed that a little bit as the program has evolved and as our third wave started and transmission has changed. So over the last couple of weeks, we've been looking at communities where there's high rates of transmission and lower rates of immunization. And that could be for a variety of reasons. Could be because it's a younger age population in that community. It could be because people in the who are eligible in their 70s, for example, aren't accessing vaccine, or we're not making it available in a way that is accessible to them. So we've been doing a lot of work with our teams in every health authority to identify what are the issues that make it a challenge for people, what are the barriers for people to be immunized. And we know that for some of those communities, the 13 highest risk communities where we had the least immunization, we identified those last week, and we targeted starting with AstraZeneca's clinics in those communities at a younger age group. And we're looking at, we know that many of these communities are racialized communities, people who may not be comfortable with information that we're putting out from government, that we need to engage with community leaders to get people immunized. And Fraser Health is doing some amazing work in some of these communities, and we'll be doing more in the next little while. So we will continue to target now, given that where we're seeing transmission rates, and if we look at some of the communities that we're talking about in Surrey, for example, many of the people who live in those communities work in our grocery stores, work in our healthcare system, and we need to find ways to support them to be immunized as quickly as possible. And we are continuing our worker program, and we had a list of workers that we were hoping to get through in April, given what we, at the time, thought our supply, particularly of the AstraZeneca vaccine. As you know, we've had challenges with the safety signal with the AstraZeneca vaccine, meaning we had to change that program, and we've had issues now about the age that we can offer it to. So we have continued, and we focused on first responders, school staff, and childcare staff. And again, because of lack of vaccine supplies, we've had to do that in a phased approach, starting with the highest risk communities. So, for example, Surrey got immunized, the fire services, the school staff in Surrey, childcare in Surrey started before some of the other areas in Fraser Health. So that continues, and will continue. This week is a very stretched week in terms of amount of vaccine, but starting next week, once again, we'll be able to open that up more rapidly. But all first responders, school staff, and childcare staff will be immunized in the next few weeks.